Hello, my name is Shrinkhla Sahai. I'm the co-founder and lead psychologist at Swayam Foundation, a mental health nonprofit based in Delhi NCR. And I've been part of the 2024 cohort of WomenLift Health Leadership Journey. And I'm really happy to be sharing my journey with you all today. So my leadership project is titled Spark, Suicide Prevention Awareness and Resilience Kit, addressing suicide as a public health crisis in India. As a mental health professional, this is something that I have been working on for quite some time as a suicide prevention trainer, and it's something I've been quite passionate about. So, the project focuses on a gendered perspective on suicide. The statistics are on your screen, and you can see how devastating they are. Women are 1.5 to 2 times more likely to attempt suicide than men. And in the Indian context, India accounts for a very high suicide death rate, much higher than the global average. And it has been one of the leading causes of death for Indian women aged 15 to 39. So, factors like gender based violence, social, cultural pressure, caregiving burdens, body image issues, mental health stigma, all have contributed to a very specific cause and effect in terms of the high suicide rates and suicide attempt rates in women. And the project addresses this in two ways. We've centered women in this project as beneficiaries as well as trainers. So the trainings are geared towards women and to create a curriculum for a gender sensitive, culturally sensitive, intersectoral approach towards suicide prevention, and also to create resources and to mentor and develop women as change makers, mental health advocates, and suicide prevention trainers within their own communities. Now, what is my reason for taking this up as my leadership project? As a psychotherapist, as a mental health professional, I have seen firsthand the unmet needs of women, the stigma that they carry, the vulnerability that they find themselves in, and the absence of safe and supportive spaces. And it's very important to amplify women's voices in critical public health interventions right now. And this is what the project aims to do. So, the different components and interventions within this project are three. The first is the suicide prevention first aid trainings to train women to identify warning signs, provide immediate support, and connect individuals to professional help. Then there is the development of resource kits for suicide risk assessment and self-care and crisis response, and to distribute these kits within different communities to make them adaptable to different cultural sensitivities, and to train women, train the trainer program for women and support groups that can enable women to become skilled facilitators in suicide prevention in their own communities. And these are some of the impacts. The immediate outcome has been that we have trained over 250 women in suicide prevention first aid and increased awareness. At the community level, we've been able to get several stakeholders on board and begin support networks and make resources accessible to different communities. And the long-term effect is to train more and more women leaders in suicide prevention to become mental health advocates, to improve mental health equity, and to have a scalable framework for gender sensitive and culturally sensitive suicide prevention training models. I'd like to share a little bit about my own leadership journey. When I started out, I came in with this question of, am I even a leader? And how do I become one? I've learned through this journey to embrace my authentic voice, to use my empathy and my vulnerability in addressing a sensitive issue like suicide, and to center women, mentor them, develop them as change makers, especially using their lived experiences and marginalized voices to develop culturally specific tools and evidence based practices. It has been an amazing journey for me where I've been able to use my skills and integrate them towards a strategic approach towards leadership and to work towards my leadership promise. I'd really like to thank Women Lift Health for this wonderful, wonderful opportunity, this amazing program, and all the coaches and mentors for their support, my amazing cohort and peers whom I got to meet through this program, and of course, my friends, family, and Swayam Foundation, my home ground, where I've been able to pilot this project. Thank you very much.